Blood pressure assessment. First, I will briefly list the required equipment for assessing blood pressure. You will need a blood pressure cuff, a manometer, and a stethoscope. It must be noted that the patient should sit quietly and still for at least 5 minutes with no caffeine 30 minutes prior to having their blood pressure taken. Have the patient sit on a chair with back support, with their feet placed flat on the floor, back straight with a neutral spine, and palms facing up to reveal the brachial artery. Be sure to have the appropriate cuff size measurement and note the location of the artery mark on the blood pressure cuff. This marked line will be placed directly above the brachial artery, which sits just below the bicep on the inner portion of the arm. Many adults may require a large adult-sized cuff. Wrap the cuff firmly around the upper arm of the patient. Be sure that the stethoscope's prongs are facing outward before placing them in your ears so you'll be able to hear the krakow sounds. Tap the chest piece of the stethoscope to ensure you can hear properly. Place the chest piece directly on the antecubital space below the artery mark of the blood pressure cuff. Quickly inflate the cuff pressure to 200 millimeters of mercury. Once the cuff pressure is at the desired amount, slowly open the valves of the cuff to release pressure and listen closely for the first krakow sound. Slowly release the pressure at a rate equal to 2 to 5 millimeters of mercury per second. Systolic blood pressure is the point at which the first of 2 or more krakow sounds is heard, and diastolic blood pressure is the point before the disappearance of krakow sounds. It appears this patient's blood pressure was about 115/75, which is considered normal. The norms presented in the following table for resting blood pressure are for those older than 18 years old. To use these norms, individuals should not be taking hypertensive medication. If either of the two measurements fall into different classifications, the higher classification should be selected. It is recommended that all individuals over 30 years old have their blood pressure taken annually. Thank you.